Hi, I'm Tina Ketchy, and I'm here to reach out to a very special group of people, medical professionals. If you are a doctor or a nurse practitioner, physician's assistant, any medical professional that is faced with the really tough task of talking to patients and families about life-limiting illnesses, end-of-life care, potentially referring to hospice care, message is for you. You go to medical school to learn how to make people feel better, to learn how to cure their illness. You didn't get a great deal of training about how to have these difficult conversations. And that's really disappointing because you might care for a patient their entire life. And then when there's an end-of-life situation, you're just not equipped with how to handle that situation. You feel like a failure because you couldn't cure the illness. You don't want the patient and family to feel like you gave up on them. And so you're just in a real pickle about what to say, when to say it, how to say it. It just basically makes you feel very uncomfortable and anxious. And I'm here to tell you there is a wonderful path at the end of this conversation that will allow you to let go of all that fear and start feeling really comfortable and confident having those conversations. I worked in hospice care for 13 years. The first 8 years, I educated the general population about hospice. The last 5 years, I educated medical professionals. And I was absolutely shocked to discover that the medical professionals didn't know any more than the average person walking around the street. They had the same myths, the same misunderstandings, the same discomfort with even broaching the topic. And that's just not okay. Baby boomers are turning 65 years old at the rate of 10,000 every single day. So it is imperative that you get this kind of training so that you can feel comfortable and confident and not shy away from those conversations. And most importantly, have your patients and their families know that you're there with them, walking this journey with them, just like you did the first 70, 80, 90 years of their life. And you're there with them. You're not going to drop them like a hot potato simply because you're just really uncomfortable with that end-of-life conversation. So my invitation to you is to click the link below this video. Let's jump on the phone. Let's talk about how we can get you from the fearful place that you're sitting in right now, the discomfort that you're sitting in right now, and how we might take you to a place of confidence and just walking away knowing that you are giving this patient and family, all of you, the best kind of advice and guidance and support that you can give them so that the end-of-life experience is a beautiful experience. And they know you were there with them and you weren't shying away from what is an obvious situation. So please, you probably know if you're one of the ones that really struggles with this, is really uncomfortable with it. And it's time to get comfortable with it. And I'd love to talk to you about how we might make sure that happens for you. So click the link below this video and I look forward to talking to you soon. Thanks.